Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Care. I wanted to cut a video real quick discussing when do you want to use ice on an injury and when do you want to use heat. Patients are very commonly mixed up on this deal, and for good reason. I love research. I love reading through research abstracts, and I write a weekly research-based blog on spinal manipulation, manual therapies, things of that nature. In school, it was pretty clear. When you very first hurt something, the main thing you want to do is to fight the inflammation and the swelling. So what you do is you put ice on a fresh injury, because what ice does is ice will close down the veins in and out of the area, the blood vessels. So what they call vasoconstrict. So just think about when you put ice, or when you get cold, you kind of shrink in, right? Well, think of the blood vessels in that manner as well. They vasoconstrict. So what you're doing is you're making it more difficult for swelling to get to the area, and you're definitely fighting inflammation. And in addition, ice is basically nature's numbing agent. So as long as you got it on there, you're going to numb the pain a little bit. So remember, fresh injury, ice. Usually the danger of inflammation is going to be passed by, say, 72 hours or so. So after 72 hours, the rule has always been put heat on it. So heat is going to vasodilate, or open up the blood vessels, encouraging blood flow and encouraging healing. Think about back in science class, junior high science, the experiment where you fill up a balloon, you blow a balloon up, you tie it off, and then you warm up the balloon. Well, you don't put any more air into the balloon, yet the balloon still gets bigger because all the molecules get excited. So same idea. So once the danger of inflammation and swelling is past us, we start putting the heat on an injury to encourage and excite the area, encourage healing, open up the blood vessels, trying to get more blood flow and a quicker healing. That was the general rule. However, there is a side of the ice-heat battle. There is some research that is showing that ice beyond 6 hours after an injury really impedes healing. So, and that's pretty good research and a pretty good argument. I would say, in my opinion, what I tell my patients is that if it's beyond 6 hours after an injury and you feel that it's not swelling, it's not just killing you, there's not any significant inflammation there, then heat may be okay. I would say anytime something is super sharp, is swelling, inflamed, then ice is probably the way to go. If something, however, is super inflamed and really sore and hurting, and you put heat on that area, you're actually going to make it worse. So certainly the first 6 hours, only ice. After 6 hours, it gets a little more sketchy. So I think after 6 hours, it's going to be more personal preference, and as to whether it's inflamed, whether it's swelling, and how badly it's hurting. So when you take those factors into consideration, you're going to have to make a good judgment call. I would say the safe bet in the first 72 hours is ice. Beyond that, the best bet is going to be heat. But like I said, there's some playroom in there, somewhere between 6 hours post-injury and 72 hours post-injury. I would also say that when you apply either heat or ice, you would want to put it on in a rotation of 20 minutes on, 40 minutes off, 20 on, 40 off, repeating as often as you're able to. Also, make sure you don't sleep on a heating pad. A lot of people come in, they say they slept on a heating pad. That is not advised, so don't do that. And beyond those general recommendations, if you have any specific questions, be sure and give us a holler. Our number is 355-3000. Consultations up here at Creekstone are absolutely free at all times, so be sure and call us. And I hope you enjoyed this video. Be sure and subscribe to our channel, hit like, and be sure and share it with your friends that you think could use some good information on whether to use ice or heat. Thank you.